We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, doctor of physical therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the podcast this morning. Today we are talking about why ricing your injuries is really the worst thing that you could possibly do for an injury. And RICE is the term that we've used since the 70s. Rest, ice, compression, elevation. So if you are resting your injuries, it is literally the worst thing that you can do. And that's for the majority of injuries. Sure, if you break a bone, we need to immobilize that, put it in a cast. If you had surgery on a shoulder, you need to put it in a sling. But even those cases, at some points, we need to start moving. And the only case that really needs complete rest is postpartum. And when you have a baby, after having a baby, there's certain portions of rest that are really important. If you've had some trauma where, a wound needs to heal, and we don't make sure not to stretch it, make sure not to load it. And then also if you broke a bone. So those are really the only cases that we actually rest, but there are still implications if you do have those things that we need to get moving as well, because you need blood flow, you need nutrients, you need oxygen to tissue, and we're going to dive deep into all these things. There's been an evolution of the way we treat injuries, and we're going to go over that. And I love this evolution because we're kind of stuck in the 70s right now in our world of rehab, in the way society thinks about how we optimize rehab. And we use the term RICE, rest, ice, compression, elevation. And it was coined by a doctor, Dr. Gabe Markin, back in 1978. And he came out and he said, we need to RICE our injuries. We need to rest them. We need to let them heal. We need to ice them for as long as needed. We need to compress them and elevate them. And some of those terms we still use, but rest, in 2014, this doctor came out and said, I was completely wrong. He took back his original research, and he said that those things in particular, ice and rest, delay the healing process. And we're going to dive deep into that. But then in 2010, so kind of backwards, 2010, there's a new term that came out called POLICE. POLICE stands for protect, O for optimal, L for load, so optimal loading at the tissue. And then we have the ice, compression, and elevation. So that was in 2010. And then the newest term that's come out now is called peace and love. And it's really what we call a biopsychosocial model. So meaning we take into consideration the biology and how it heals, the psychology and how our mind thinks and how we understand injury, and then how we perceive the overall rehab process, not being fearful of movement after and things like that. So the P stands for protect, just like the police. E stands for educate. We need to educate people on reducing their fear, reducing their anxiousness about movement, that they're going to, blow up their back or they're going to blow up their ankle, all these types of things, because a lot of that's just not true. A stands for avoiding NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, such as ibuprofen, Advil. These drugs that vasoconstrict. They limit blood flow to the tissue. They're helpful for pain, so we'd use them for pain. But we'll go over the specifics on why we don't use NSAIDs for injuries anymore. And then we have compression. So C is for compression. E is for elevation. Notice those two things have stayed since the 70s. Those are really important. Edema management, what we call edema is just fluid buildup, swelling. So you want to be able to manage that. The body's natural mechanism after an injury is to swell up. The reason it swells up is because the body is trying to stabilize that now injured joint, and we need to manage that. So swelling is good. It's part of the healing process. But if it gets too big, then you can't move it, and it just kind of delays the opportunity to get out of that injury in an efficient manner. So now going on to the love portion. So the love portion, the L stands for load. Load is so important, and it's a challenging term because the general public says, okay, load it, right? Do I strength train it? Do I run on it? That really depends on the tissue that is injured. It depends on the level that at which it was injured, if it was really early acute or if it was subacute, after a month or a chronic. We load it differently depending on how much injury is to the tissue and what type of tissue it is. So we'll go into a few specifics in there. But load is probably the most challenging part about the peace and love term, because the general public doesn't really know how to load tissue appropriately. But we'll go over some specifics that'll be helpful to you. O stands for optimism. The body has a natural way of healing itself. It's beautiful. It has an internal program of how it heals itself, and that's just the default of what our bodies do. So knowing that, having that level of optimism is super important. Because if I had $1 for every patient that came in and said, my dad had a bad back, therefore I have a bad back, I've had a bad back my whole life, there's so much non-truth to that. Like, that is the furthest thing from the truth. We don't just naturally have bad backs. There's really no data to support that. There are some genetic components that you might be predisposed to that. So meaning that you might be more likely to have those things, but you can completely change that evolution. So keeping that optimism through injury is super important, because sometimes our bodies just get so heightened and intense, and that's what creates a lot of our pain. V stands for vascularization. Vascularization means blood flow. Blood flow is nutrients. I always tell kids all the time, it's food to the injury. We got to get food to the injury, blood, nutrients, oxygen, all those things. So we use aerobic exercise. It could be a bike, it could be swimming, it could be something that's going to offload that tissue, but you're going to get your heart pumping. It pumps blood to that tissue, which allows for it to heal. And then the last E stands for exercise. We want people to be confident. Right? Bracing might be important. Taping might be important. Stabilization might be important. But the quicker we get back to exercise, the quicker you get out of your injury. That doesn't mean you go into pain. No pain, no gain. That's not true at all. You got to be thoughtful about how you exercise. But exercise helps with the vascularization, helps with that blood flow, and can be so important. So now that we've gone through this evolution of how we rehab injuries, we're going to go into some common myths. We're going to go into some common questions that the society has, and kind of just demystify a lot of these things these belief systems that we have. So pay attention. These things could be very helpful for you as you have family members that have injuries, that you can manage yourself. We really want you to be as autonomous as possible. And if you get stuck, see a physical therapist, a musculoskeletal expert that can help you through that rehab process. So Lauren, take it away with our first question.
Alrighty, I'm so excited to dive into this. So our first myth that we have is you should rest completely until pain is gone. Why would you recommend we not do that?
So anytime you're just resting an injury, we did a bed rest study where we put college students in bed for 7 days, and when I was in graduate school, and actually this was my undergrad, and we wanted to measure how much muscle mass they would lose just in a 7-day period. And we measured their thighs, and we did pre and post testing with both leg press, so how much strength they had, and it was a dynamometer, so we could figure out, okay, how many pounds of pressure could you push, and then we measured on an MRI how much fat and muscle they lost over time. And that was my job. I had to trace the muscle and figure out how much fat was in there and figure out how much muscle was in there. And these people, they had to sit in bed for 7 days. They only could stand up, go to the bathroom, and sit back down. They couldn't take any steps. So this was complete bed rest. And just in a 7-day period, some of them lost up to 50% of their strength and up to 3 pounds of muscle. And you think about like how detrimental it is to our bodies to completely rest things. Our body's default is to break down with the intention to build back up, but it's how we program it. If we're not programming our bodies to consistently build, they will consistently break down. That's why people, as they age and they're not as active, they're not, doing the things that we recommend as exercise and strength training, their body slowly starts to decline. And that's just the way our bodies work. And the purpose of that is to heal. because if we have a cut, the body it has macrophages that go in there and they kind of eat up the material. And then it has repair systems that lay down tissue and then build it back up. But the default to break down is because it is meant to heal and it's supposed to build back up. That's just how our bodies work. They're not like a machine that just wears out and you got to replace all these parts. It's purely programmed to rebuild, right? Unless we abuse it, right? Unless we are going beyond our ability to actually do the activity. We're pushing our bodies to complete failure and past it. That's when you can have that wear and tear and things actually wear out. You might wear out the cartilage. You might dig into bone, right? You might tear a tendon, right? That's beyond failure. But for the most part, all tissues in our body, they actually get stronger as you add appropriate load to them. So rest, don't do it. Like it's just, it literally delays the healing process. And you even think about blood flow alone. Blood flow is not getting to the tissue. We went over peace and love. Like you gotta get vascularization to the tissue. You gotta build your confidence, right? And research shows if you're getting back to exercise within 1 day, right? And you're moving that tissue gently, right? Whether it's, let's just say it's a sprained ankle and I'm moving that. Some studies report that you are 78% quicker getting back to the field in your activities than if you were not, if you were to get back to exercise in 7 days. So you are like significantly more quicker to get back to recovery if you start day 1 than starting day 7.
Okay, that's really, really cool. I didn't understand all the science behind it, but it's really cool to learn. Our next one is ice speeds up healing. What are your thoughts on that?
So ice, the purpose of ice is to decrease nerve conduction velocity, which is your brain's ability to interpret pain, right? So there, say, again, I sprained my ankle. There are nerves, there are 5,000 miles of nerves that go throughout your body, and these nerves are just a communication line. So the body perceives pain, so it's going to send a signal. It's perceiving tissue damage, right? So sometimes it could be tissue damage, sometimes it isn't, right? But it sends the signal from my ankle to my brain saying, you damaged something, you need to attend to it. The ice, when we put that ice on, it slows that nerve conduction, right? So it slows the communication down. So instead of getting signals, let's just say, for example, at 500 miles an hour, now we're shutting down lanes on the freeway to maybe 1 or 2 lanes, and we're slowing traffic down, right? So the signal's not as nearly as quick. It's not getting to our brain as fast, so therefore our perceived pain goes down. So ice is really helpful to decrease pain. What it doesn't, and another positive effect from it is, say you have a lot of swelling, right? People are like, oh, I got to get ice on there to decrease the swelling. That is true for the first 24 to 48 hours. Because it's going to swell up, and the ice does is it vasoconstricts. So it means your vessels get smaller, therefore it gets less blood flow to the tissue. And I always ask people this: if you have an injury, would you want less blood flow to your tissue?
No, because you want the blood flow to heal it.
Yeah, you need nutrients, you need food, just like the example we talked about a minute ago. Like, blood flow is food to the injured tissue. If you limit blood flow to it, it's just going to delay the healing process. Now, ice is helpful for pain. So if you're so painful, you're just numbing it, right? So you can numb it to feel better. And sometimes that's an important component. But the first 24 to 48 hours, essentially we're decreasing the ability for the blood to, we're trying to clot it all, right? It's clotting down, so you don't have that internal bleeding that continues to swell. And then once it all clots down, then we start using other mechanisms, heat, make it soothe, because heat does the opposite, vasodilates. So our vessels now get larger. So do we want more blood flow? Absolutely. It's going to get more blood flow to tissue. People are like, oh, it's going to increase inflammation. That's not true. Like, if it's still irritated, yes, but you want more blood flow to the tissue. You don't want less.
Okay. So try not to use the ice as much as possible unless it's for pain.
Exactly.
Perfect.
Yeah. For the first 24 to 48 hours, ice is very appropriate.
Okay.
And then after the 48 hours, do something else unless you need it for pain.
Alrighty. That's really good to know. Our next one is swelling always means something is wrong. So this one kind of goes hand in hand.
So we'll see people that are, have had an injury. I had this one gal in my in early internships in my doctoral program that had a case called CRPS, complex regional pain syndrome. And she sprained her ankle. And this was 2 years later, and it was still swollen. And so the question is there tissue damage in her ankle? At that point, the body, 30 to 60 days, is going to heal the majority of issues that you got going on. Unless it's like a cartilage thing or something that has limited blood flow, like your internal meniscus in your knee. Those take a little bit longer, but for the most part, the body heals within 30, 60 days. So the question is, why is her ankle still swelling? The body sometimes gets a little confused, and people think, oh, you're telling me that's my head. It technically is in your head, but you're not making it up. Your body believes that there's something continuously wrong with your ankle, and it's sending signals down there, sending inflammatory signals and tissue to that to repair it because it thinks it's still damaged, right? And that's why it's so important to go through the rehab process so you don't get stuck in that cycle, because this gal in particular got stuck in the cycle, and she got to the point where she wanted to amputate it. And she's like, I have so much pain in my ankle, I just want to cut it off. And if you can imagine getting to that point, right? And all she did was have a simple ankle sprain. And this doesn't happen to everyone, by all means. Like, this is really rare to have CRPS, but it happens. And sometimes the body gets stuck in that cycle, and the brain starts to change its mechanical makeup, and the signals in the brain actually get larger and larger and larger, and your pain perception increases. So the question is, well, what do we do with those people? We follow peace and love. We teach them confidence. We teach them that it's safe to move, that your ankle's no longer, there's no tissue damage. We show them. We have them look at it. We have them move it. We have them do exercises and build that self-efficacy. And then over time, it goes away. And great news, this gal did super well. 12 weeks later, it took some time, but 12 weeks later, she was running again, and it was absolute miracle. Wow. But sometimes the body swells up, and it's just part of that process, and you got to work through it and have a skilled professional that can help you through it.
Yeah, that makes a lot of sense. I didn't even know that the body could do that. So, our next one is, if it hurts, you're making it worse.
So there's some cases we actually work into pain. So, some jumper's knee, we'll usually take away jumping for a little bit, but we will add isometrics, and we actually want them to push into pain. Golfer's elbow will push, into 2 to 3 out of 10 pain. For the majority of the time, if you're working into pain, besides those cases, you actually are most likely making it worse. So, if someone's hurt, say they, they strained a rotator cuff muscle in their shoulder, and they're going to the CrossFit gym or just going to work out, and they're doing lifting, is what we'll usually tell them is keep lifting, keep doing all those things, go to the gym, get your aerobic conditioning, all those things, but just don't go into movements that are painful, right? And that can be a good guide, because your body is just it's sending a signal to you saying that there's something wrong, right? Mm-hmm. But we'll teach people certain parameters of what to go into and what to not go into. But as a general rule, if it's painful, don't go there, and then get some help if you can't figure it out, because like I said, some things we want to push into pain and some things we don't at all.
Okay. That makes sense.
Have you ever had any injuries like that? You're like, I'm just going to push into it. Wait, you never get injured, right?
I never get injured.
Lauren just does it all right, and she follows good parameters and listens to her body. And I think that's so important, right? I haven't had injuries in years other than self-inflicted where I break bones. But, for the most part, I don't get injured because I listen. Right? Your body is telling you things. It sends you signals, just like a check engine light on a car. Like, it will send you a signal saying that there's something potentially wrong. And if you attend to it, then it fixes the problem. If you ignore it and just push through it and say, I'll just no pain, no gain, then it typically turns into an injury. So kudos to you.
As I'm currently a patient. It's fine.
We missed that part. Okay, go on to the next one.
Okay, for the next one, you need to wait weeks before moving an injury.
Absolutely not. You get that sucker. I think we already abolished that, but
Yeah.
get that sucker moving day one, right? The professional athletes, as soon as someone gets injured, you know where they're hauling them off to on the gurney?
PT.
In to see the physical therapist or athletic trainer, right? Like they are moving it right then. They're compressing it. They are elevating it. Like it is getting moving day one, like literally immediately after the injury. So get those puppies moving, but work through gentle ranges and gradually progress that to where it's not painful. But there's something you can do. Whatever that something is, whatever that limited range of motion, just slowly expand that more and more and more. Like I said, some studies say you're 75% quicker back to normal activity if you would start day one versus day 7. So do not wait.
Alrighty. Yeah,
Get 'em
that's
moving.
good to know. Get it moving.
Let's talk about anti-inflammatories. So we talked about anti-inflammatories. A lot of people think, oh, I got to get some pumping some ibuprofen. It's anti-inflammatory, right? It's not adding inflammation. And what they don't realize is it's doing the same thing as ice. It's vasoconstricting all of your vessels systemically, which means your whole body, and it's limiting blood flow, right? Again, do we want to limit blood flow or do we want to get more blood flow?
More blood flow.
Yep. And we want to get more blood flow, but we also want to control the swelling. So if it's swelling up like a balloon, like get it elevated, get it compressed, right? Maybe decrease your activity just a little bit or decrease the level or intensity of activity too. People don't realize that the intensity might be too much, but sometimes just sitting at your desk with your feet on the floor is too much if you sprain your ankle. So getting that foot propped up, right, is really helpful. Getting it compressed. If it's 24 to 40 hours, get it compressed and iced. You know, all those things are really helpful. But only use anti-inflammatories if you need pain relief. You know, but even just getting Tylenol. Tylenol is typically a better option as long as you can take Tylenol, right, for injuries, because that helps with pain only. It doesn't vasoconstrict.
Oh, okay. How would you recommend people go about compressing their injuries?
That's a great question. There's a lot of advice. I mean, you can just go on Amazon and figure out compression. You can put ACE wraps on and just overlap it by 50%. ACE wrap is typically one of the better options, and just put 50% stretch on it. And then obviously monitor your toes. You saw blood flow. Is it going numb, right? You don't want to have it too tight. But there's a lot of, the vasopneumonic compression devices now, like the boots. Those are really helpful. Just really compress it, starts at the foot and kind of works it, massages it down. So those are a lot of good options, but even something simple as a brace, right? Just getting a brace on your, I'm using the ankle example a lot, but say you sprain your ankle, getting a brace on it can keep it compressed at the joint enough to where you can walk throughout the day, not consistently irritate it, and it keeps it compressed. So it really depends on the area. You can get knee sleeves for the knee. You can get elbow sleeves for the elbow. Shoulders a little bit tougher, right? But your shoulder's above your heart anyways, so you don't need as much compression when it's above your heart. It's really lower limbs that are mostly limited.
Okay, that makes a lot of sense.
Because the idea is you're just getting it up either level to your heart or above your heart.
Okay. So that's where to elevate it is above your heart.
That is the ideal.
Okay.
At least if you can get it to heart level, then the body doesn't have, you're kind of thinking about it as a drain system. And just think of it as like you have water in a pipe. If you tip it back towards the heart, it's going to drain towards the heart, right? If you tip it forward, it's going to drain towards your feet. So that's kind of the general idea there.
Okay, that makes a lot of sense. I feel like that's really helpful. Let's see. Strength comes only after pain is gone.
So when you are in pain, the body, it has a natural inhibitor. So it actually shuts down muscle. Inhibitor means it's stopping muscle activation. So say, for instance, someone tore their ACL. After surgery, sometimes they'll use what's called a block, which will block a nerve, which also, it blocks sensation and motor control, which means that you have lack of ability to contract the muscle now to move it. But even without a block, your thigh muscle doesn't activate nearly as much because you were in pain. So if there's a pain signal going to the muscle, there's also an inhibition, meaning it lacks its ability to fully, the motor units in the muscle to actually squeeze. So it's essentially shutting down systems, saying there's an injury there, let's shut it all down. Shut down IL-3, nothing's functional, right? So the muscles are only working at 50% effort, right? They're not able to turn on as much because everything hurts. So the body, that's its natural way of decreasing pain. Just shut all the muscle down. But I always ask people, like, do you want to shut muscles down around an injury? That means lack of stability. That means lack of control, lack of, all the ability to stabilize the joint. So not a good idea, right? So the idea with rehab is we get the pain to go down by using our different techniques, using modalities, using our hands-on techniques to decrease pain levels, and using ice, using, all these things that we've talked about, but simultaneously getting the muscle to turn on and turn off, because that's where people struggle the most. And that's why it's so important to start day 1 with rehab rather than start day 7. Because your muscles stop working on day 1 or significantly decrease their activity, and then day 7 they've already atrophied, right? We go back to that up to 50% decrease in strength. Yeah. You may gain that back in 4 to 6 weeks, sure, that what you lost, but you can get back to activity so much faster and efficiently if you follow the guidelines.
Okay.
And no one wants to stay in an injury longer than they have to, right?
Yeah.
If you want to just drag this on, sure, you can make 7 days. The issue is with that too, is you lose mobility. Most people lose mobility for life. If I could, explain how many people have come to me with back pain that actually started because of an ankle stiffness, because is what they do when they go squat, they'll throw a barbell on their back and have some heavy weight, and their ankle is stiff just on the left side from an ankle sprain they had 10 years ago. When they squat down, the knees come forward naturally. So what happens is when they go to squat, the one knee will come forward and the other one won't, because it limits its ability to move forward. So then as the knee comes forward, you actually have a rotational force through your spine and your pelvis as you squat heavy, and then it's loading the spine in a torsional manner as you go to stand back up. Oh. So a lot of people are like, well, yeah, it goes down the chain, up the chain. That's how it goes down the chain and up the chain, because it literally changes the mechanics of your spine when you squat because your ankle is stiff. So if people lose the mobility for 10 years and then they start lifting heavy or just doing some goblet squats or even just body weight squats, they're going to have this rotational movement through their pelvis and spine, and then you just continue to overload it, either through a lot of repetition or a lot of load, and then it gets irritated. Sure, if you're not going to work out or not going to do, go put sod in your yard, like you're not going to have that level of repetition, you won't feel it. But the minute you start loading heavy or start doing a lot of repetition, that's when you will feel it.
I feel like my mind has just like
with that. It's biomechanics, but that's the simple way of thinking about it, right? We can go a lot more in depth on the biomechanics, but each joint, if it limits its mobility, we are symmetrical humans. Not saying we have to be completely symmetrical, but that's how we move. And, the perfect way to move is like a toddler. If you've ever seen a toddler sit, have you ever seen a toddler squat? They can sit in a full squat position and just hang out there for days. How many adults can sit in a full squat and just hang out? They're either lacking ankle mobility, lacking hip mobility, lacking stability to stay there, right? They've developed these imbalances over decades, and we just got to get those things dialed back in.
Okay, that makes a lot of sense. Alrighty, I have another myth for us. Recovery is purely physical.
Recovery is purely physical. What am I going to talk about there? So recovery is a lot physical. But you think about the brain's ability, it has to recover too, right? So our brains actually have to get rest, like physical sleep, and shut down. And you can do that through, your short naps throughout the day, 15-minute naps. I did this stroke camp, and it was very intensive stroke, right? So people had a brain bleed or had a blood clot in their brain, and they lost ability to utilize one side of their body. And we did an intensive 2 weeks, and they stayed with us from 8 a.m. to 3 p.m. every day. And it was very intensive therapy. It was going from one circuit to the next. And we required them to take a nap in the middle of the day, because the research showed that the brain's ability to consolidate information the programming happens when you're asleep. So if you want to learn new motor programs or a new skill, or you're lifting heavier and your body needs to consolidate and repair, the brain has to rest as well. And that's when it starts to compute things and keep things in long-term memory and short-term memory, is when you actually allow it to not have to do any work, right? And the brain's still working as you sleep, but that's how it consolidates information and processes the whole day, is when the brain is actually at rest from conscious ability.
Mm-hmm. Wow. I had no idea. That's amazing. Is there any other part of love and peace that we want to dive into deeper?
Peace and love should be the gold standard now. Society needs to catch up to that. It takes decades to repair old research and get the new research out. But this is our attempt to get this research out, that you are literally doing the worst things for your injury if you are ricing them. Rest, ice, compression, elevation. Don't rest them. Hope we hit that home. Get moving, stay optimistic, stay super optimistic. Know that your body will repair itself. We have a natural ability. And if you have a chronic disease, sure, chronic disease is its own thing. But I actually do believe, even with chronic diseases, that you have a natural ability to heal yourself with your internal belief systems. And I've seen that myself. I've seen that in hundreds of patients that I've served. And it's amazing when you start to be optimistic about the future, how your body just naturally just recovers and can, cancer is just, it's internal disease from something happening, right? And it could be that you've had years of anxiousness, years of bad food or bad diet that's just added up. And, a lot of these things can be corrected with proper diet, with exercise consistently, with, doing the right things, getting enough sleep, making sure our systems are calm and not at a highly anxious state. But really, this should be the new gold standard, this peace and love, because the biopsychosocial model is really the model of the future, because there's more than just the physical. There's the mental, there's the psychological, there's the social, right? And we got to have all those components. It's not just sitting and letting it do its thing, right? We need sunlight, we need nutrients, we need friendships, we need connection. And that is the wave of the future, taking all things into consideration, not just physically repairing itself.
That's amazing. Wow.
Any other last thoughts as we wrap this up?
Yeah.
Oh, we better talk about optimal loading. I think we need to add a few components there. So the last piece that we want to add to this podcast is optimal load. Optimal load is super, super important. So we talked about it a little bit. If you have, let's go back to the ankle sprain, it swells up. You want to start moving it. We might start with some ankle pumps, some light ankle pumps. You go to where it starts to hurt and then come out of it. Starts to hurt and come out of it. And try to get as much range as you possibly can. And you're going to touch the pain. I tell people, kiss the pain. Kiss it just gently and then come out. You know where it is and come out, right? And you'll realize you're able to go further and further as you kiss the pain, right? So just keep kissing it. And when you kiss it, you show it some love, And it's super important that you do that. So then we'll add some circles, some gentle circles with the ankle. And then we'll add some ABCs. But we optimally load it based on the response. And it's really sometimes kind of tricky because you're like, do I go into it? Do I not? Sometimes we do push into it. Sometimes we don't. And that is a lot of education to determine what tissues we can do that with and what we can't. But if I was to give general rules, just kiss the pain. You won't be in trouble if you kiss it, right? And just you're touching it and you're getting out. Imagine it's a big hungry bear and you can poke it all day, but don't wake it up, right? So you want to get in there, get out, get in there, get out, because that's going to get vascularization there. That's going to get exercise. It's going to get nutrients to it, oxygen, all those things to help repair it. And it will get the bad tissue, the repairing tissue out to get new tissue in to form and to build up. And then the body, when it heals, it lays down tissue in an unorganized way. So it's like spaghetti in a pot. It's all tangled up, all unorganized. The way it gets organized, so we're thinking like all cross-hatched, right? The way it gets organized in alignment is through movement and you teaching it how to lay down, because it just lays down like this really fast and it gets really stiff. That's scar tissue. And how do we get it to lay down nice and thin and essentially in line with each other is you have to teach it how to form. So you teach it how to move. You move your ankle up and down, and you're teaching that tissue to stretch and to come back based on the movement. But if you never move it, then it just becomes keloid. It becomes really stiff. It becomes, all this fibrotic tissue, and it takes a long time to get out of that. And it becomes really stiff at that spot, right? But if you move it early on, I'm not saying like if you have a cut or a wound that you're stretching it and manipulating it. Once the scab is gone, that's when you need to start moving it, right? But for an ankle sprain, we want to get that moving really quick because tissue is repairing in there. It's laying down, it's stiffening up, and if you don't teach it to do a different pattern, it will go to its default of just staying stiff. And then after the ankle sprain, you got to make sure you train it to a high level so you don't have an ankle sprain again, because there's nothing that increases your likelihood of getting another ankle injury than having an ankle injury. I believe you're, if I remember right, 40% likely to have another ankle sprain if you have one ankle sprain, right? But if you train it and you do high level activity, stability exercises, ballistic exercises, single limb exercises, all those things, then you essentially can get out of that realm and you're significantly less likely to re-sprain again. So high level training after injury is super important, making sure you have full mobility, full stability. It's comparable to the other side, if not better than the other side. And you're able to do all of your activity and more after the injury. That's what we're shooting for.
That's really, really interesting. I have one more question.
Go for it.
How do people at home know when they need to go to see somebody for one of these injuries?
That's such a good question, because the thing is, we want society to be very autonomous. That's why we're giving these tips. Our medical system is backlogged. We have so many patients, but we want people to be autonomous as possible. My rule of thumb is give it 2 weeks. Like, use these tools, use these things that you've learned, and do all those things and give it 2 weeks. And work on those things. And if it's progressing and you feel like you've got it handled, keep going. But even after, like if you're measuring your ankles and they're not symmetrical, if you're measuring your joints and they just don't feel the same, that's a good reason to get in. If you feel like you're plateauing, or if you're digressing, if you're not able to manage any of that pain within a 2-week period, I say 14 days, that's the cutoff, right? But I will say, if you get into an expert early on for anyone, it's going to expedite the whole thing. So it depends on what you want to do, right? And what you're shooting for.
On that same note, how do you know when to go to a PT or an emergency room or an Instacare? Like, how, regarding these injuries, how do people kind of know to go to which?
Any musculoskeletal injury, we are making this very well known. Any musculoskeletal injury, meaning ankle sprain, back pain, anything pain related, go to a PT. The research shows that they are 83% accurate with their diagnostic measures, compared to a primary care physician, which is 30% accurate diagnostic measures. That is not a slap to our primary care physicians. They have a very specific role that is very difficult. Their job is for illness, for disease, for all that type of management, not for pain control, right? So if you and they're going to send you to PT anyways, right? So the best, most efficient, most skilled expert in pain and injury is a physical therapist. And chiropractors are right there as well. Like, those tools are the most helpful for you to get out of pain quickly. The quicker you do it, the quicker you get in, the faster you get out of it. And our whole idea is we want to prevent it in the future as well. We want to put together a plan to where you don't have this again.
Okay. That makes a lot of sense.
Well, thank you for joining us, Lauren. And I hope for all of you that are listening, these tips are very helpful. We want to get this information out, share it with your friends, share it with your family. We want all of society to know about peace and love. Let's not rice our injuries anymore. Let's not rest them. Let's get them moving gently. Apply these principles, because they'll be so helpful to help you live the life you always wanted. So thanks for joining us today.
Thank you.